Avatar patients. Okay, Charisse, have you ever been too embarrassed to tell your doctor about symptoms or maybe medication side effects so you don't? Or maybe you feel like the doctor has no bedside manners and made you angry so you don't go to your follow-up appointment like you should. Or maybe the doctor has a very difficult diagnosis that he or she has to tell you. Your communication and relationship with the medical staff can make a difference in your health.
Yeah, I've been really tired. I've seen some other doctors about it. We can't really
Did you
figure out
know
what's
that
going on
medical schools like LSU Health here in New Orleans hire actors to play the role of patients so students can learn how to form that bond and trust to better treat the patient? But there is limited time to practice these skills, so enter the world of avatar simulation on your phone.
We're all on our phone, right? So if we could just be in their pocket to help them with whatever communication challenge they're facing in the moment. Make the mistake on their phone before they make the mistake with the patient.
LSU Health was one of only 11 medical schools out of more than 200 awarded a $1.1 million grant from the American Medical Association called Compassion in Motion.
This is something that nobody in the country has done. If you like me, if we have a better relationship, you're more likely to take my advice. You're more likely to take the medicines that I prescribe. You're more likely to follow up and see me in clinic. You actually enjoy a better outcome.
Now, since the avatar, the patient avatar, is being made right now, the technology is being developed, we still wanted to show you what it's going to feel like for the doctors in training. So we decided to come to Game On Social Hub in Kenner to show you a little bit of what it's going to look like. What it's going to be is just like one of these games where you're the race car driver and you're driving and trying to keep the car on the road, except the doctor is going to feel like he or she is in the patient room really talking to a patient who is talking back. And AI will then critique the student doctor and suggest better ways to communicate.
I can practice those tough conversations. I can practice conversations with family members that are difficult and challenging, with patients that are difficult and challenging, with difficult diagnoses, or in handling difficult questions or different cultures.
Yes, I crashed about 100 times, but a UNO professor and Videra Health in Utah is helping. They're both helping with this new technology, and the app is expected to be ready in 2 months. Eventually, the program will expand to nurses and all the other healthcare specialties at LSU School of Medicine.
All right, Meg, thank you so much. Really good driving skills, by the way.